Okay. Well, good morning, everyone. My name is Maji Johari. I'm the Member of Parliament for Richmond Hill. It's only about 25 kilometers north of here. The drive down here was excellent. And it's good to be here today with so many of my colleagues, especially Mr. MacKinnon. So it is a pleasure to be here to discuss something that affects all of us, the future of healthcare in Canada. As we all know, healthcare is a cornerstone of our society, and ensuring that Canadians have access to quality care is more important now than ever before. As we look ahead, there's a significant challenge we must address. Nearly 79,000 unfilled healthcare positions across the country. The Government of Canada is firmly committed to taking decisive actions to help ensure that all Canadians have access to the quality healthcare they so richly deserve. Newcomers to Canada have the potential to help address this gap, but first, their credential must be recognized. Unfortunately, the credential recognition process is often complex, time-consuming, and costly, which contributes to underutilization of the skilled workers in our country. That's why the Foreign Credential Recognition Program is important to help break down these barriers, integrate skilled professionals into the workforce. This program will enhance Canada's ability to assess and recognize foreign credentials, improve labor market outcome for internationally trained professionals, and foster better interprovincial labor mobility. By facilitating access to Canadian work experience, these initiatives will help internationally trained professionals integrate more quickly and effectively into the workforce. The program funds provides for provinces, territories, regulatory bodies, and other organizations to streamline and speed up the credential recognition process. It also offers vital employment support such as training, work placement, wage subsidy, and mentoring to help internationally trained professionals gain the Canadian work experience they need to succeed. This program highlights our government's commitment to strengthening Canada's workforce and ensuring that Canadians gain the skill necessary for good, meaningful employment. This is part of our broader strategy to address labor shortage and enable internationally trained professionals to fully contribute to the Canadian workforce. Healthcare workers are essential to the well-being of our country, and the demand for more of them is urgent. Today, I have the honor and the privilege of introducing Minister MacKinnon, which will outline the government's plan to reduce barriers to credential recognition, ensuring more Canadians can access the healthcare they need. These new projects are designed to meet the increasing demand of key sectors while allowing skilled newcomers to fully use their talent and experience. This will benefit communities across Canada by strengthening local services, improving healthcare access, and supporting infrastructure development. Ultimately, these efforts will contribute to stronger, more resilient communities throughout the country. It is one more sign that Government of Canada is working to grow Canada's economy. And now, it is my pleasure and honor to hand the podium over to Minister Steve MacKinnon, the Minister of Employment, Workers, Development, and Labour. Thank you, Minister. Welcome to Greater Toronto Area. The podium is yours.
Thank you so much, my friend Majid, and great to see my colleague and friend Rob Oliphant as well. Thank you for being here. Obviously, we're aware of the context in which we make this very happy announcement today, and the Prime Minister will be speaking at approximately 10:30 with a number of our colleagues to outline specifically Canada's response to the events of yesterday. Whatever happens, Canadians need to be very reassured that, number one, we will be there to support them, to protect our workers, to make programs and services more broadly available, especially in trade-exposed industries. And secondly, that we will continue with this plan, part of which I'm proud to announce today, to develop our workforce, to meet the challenges of a changing workforce, and in the case of today's announcement, to more fully utilize the potential of so many newcomers to Canada. So I've said this once, and I'd say it again, it is time that we start building in this country. Il est temps de construire dans ce pays. We need to build hospitals, we need to build bridges, ports, highways, railways, nuclear reactors, and obviously homes. Mais il y a un problème, une crise même. There is a problem, one so big it risks undermining our competitiveness, slowing our economy, and halting the progress we've worked hard to make since 2015. Je ne parle pas ici de nos voisins du Sud, non, je parle du défi du marché du travail au Canada. Right now, there are about 1 million job vacancies across the country. And in 3 years' time, another 600,000 workers across all sectors, but many in the building business, will take a well-deserved retirement. Now, you don't need to be good at math to know that those numbers do not square, nor are they conducive to growth. Many employers are already struggling to fill job openings, and that's creating a real strain on key sectors, and as Majid said, in healthcare, added workloads and pressure on top of what is already a challenging job and set of circumstances. Nous devons donc faire plus. Nous devons faire plus pour requalifier les travailleurs, éliminer les obstacles à la mobilité et à la participation au marché du travail. Nous devons soutenir la transition des jeunes vers le marché du travail et accueillir davantage de talents de partout dans le monde. We need to welcome more outside talent. Je suis certain que de nombreux Américains, des travailleurs américains talentueux dans le secteur public et le secteur des soins de santé souhaitent faire exactement la même chose en ce moment. Today, I want to focus on that last point, welcoming more outside talent to Canada. Canada is, and I assure you, will always be a beacon of change and hope, a place where people with unique backgrounds can come to seek new opportunities, to work, to study, and build new lives. Cette année uniquement, nous prévoyons d'accueillir près de 400 000 résidents permanents au Canada. Many of these people are skilled workers in their respective native countries. Some doctors and nurses, others architects and chemists, all of them unable to work in their field of study in Canada. Ce sont des professionnels formés et éduqués qui possèdent l'expérience et les accréditations dont nos secteurs et nos employeurs ont besoin. À titre d'exemple, le secteur de la santé compte actuellement quelques 78 600 offres d'emploi. Ce n'est pas normal, ce n'est pas logique, et c'est pourquoi nous voulons changer la donne. We've made some progress in this regard by working with provinces and territories. Mais il reste encore beaucoup à faire, non seulement pour attirer et intégrer plus de professionnels qualifiés au Canada, mais aussi pour maintenir la qualité, l'intégrité et l'accessibilité de nos soins de santé. Many newcomers can help us in our healthcare system. That is why today I'm happy to announce we're investing over $14 million in 4 organizations across the country through the Foreign Credential Recognition Program. C'est pourquoi j'ai le plaisir d'annoncer aujourd'hui que nous investissons plus de 14 millions de dollars dans 4 organisations à travers le pays dans le cadre du programme de reconnaissance des titres de compétences étrangers. This investment will reduce barriers to credential recognition by directly supporting over 3,500 participants through work experience and employment supports, training, and coaching. So the 4 funding recipients are the Health Association of African Canadians. This incredible organization provides culturally relevant resources, mentorship, and guidance to help professionals integrate into the Atlantic Canada healthcare system. Windmill Microlending. They support internationally educated health professionals to become employment ready and to successfully integrate into the healthcare sector across Canada. Success. Now, success is spelled with a period between every letter, so I want to get that right, but I'm going to call it success. and they are a diverse and inclusive multi-service organization with a strong presence across the country. This funding will help professionals in medicine, dentistry, nursing, pharmacy, chiropractic care, psychology, physiotherapy, radiology, dental hygiene, and caregiving. Et sans oublier, et vous l'aurez deviné parce que nous sommes dans leurs locaux, la Société économique de l'Ontario, qui se consacre au développement économique et à l'intégration de la main-d'œuvre pour les immigrants francophones. Ce financement leur permettra de s'orienter sur le marché du travail, de bénéficier d'une aide à la reconnaissance des diplômes étrangers et de services d'emploi adaptés pour les aider à obtenir des postes correspondant à leurs qualifications. Et vous aurez remarqué que hier, nous avons confirmé que nous avons atteint, voire même dépassé, notre cible en matière d'immigration francophone hors Québec. C'est une source de grande fierté pour le gouvernement. 7,21% des immigrants hors Québec sont francophones et ça dépasse notre cible. On a une autre cible agressive en 2025, 8,5%, mais pour cette année, un grand exploit que d'avoir dépassé nos cibles en matière d'immigration francophone hors Québec. So we have the talent. We have the talent that we need, in many cases, already right here. We need to help them pursue the work they spent years in their native countries learning and mastering. This adds to the more than $270 million we have invested in supporting internationally trained professionals since 2015, the $50 million more in Budget 2024, and to the 10,000 skilled newcomers we've helped find work placements, the 20,000 more we have given loans and support services to, and the thousands more on top of that who now line our hospital hallways, triage rooms, and offices as doctors, nurses, and healthcare specialists, providing quality care to Canadians right across the country. Lorsque nous éliminons les obstacles à la reconnaissance des diplômes, lorsque nous facilitons plutôt que de compliquer la recherche d'un emploi dans le domaine d'expertise des nouveaux arrivants, lorsque nous collaborons avec nos partenaires et les provinces et territoires, comme je l'ai fait vendredi pour discuter de la manière dont nous pouvons accroître la mobilité de la main-d'œuvre dans tous les provinces et territoires. When we do these things, Canadians are better off. And as Canada continues to grow, obviously, so too should our healthcare sector. And by supporting internationally trained professionals, we're doing just that. Nous prenons des mesures décisives. Nous remédions aux pénuries de main-d'œuvre, nous améliorons les résultats des soins de santé et nous soutenons une plus grande efficacité du marché du travail. In other words, we're helping our economy, our communities, and the lives of internationally trained professionals, bringing their talents to Canada. What a great day, what a great initiative. Merci à la Société de vos efforts en la matière. Thank you to all the recipients and congratulations. And we welcome your efforts and look forward to seeing the great success that you will have. Merci beaucoup.
Once again, thank you, Minister. And indeed, it is a great day. And I start by congratulating those four organizations for being the recipient of $14 million. Before I invite my other colleague, PS Rob Oliphant, to the floor, I just wanted to highlight the fact that the Health Committee recently completed a study about the status of the healthcare workforce in Canada, and one of the barriers to the success and building capacity was the foreign credential. And today, I'm so proud to be part of this announcement to ensure that we've addressed one of the key barriers in that report to ensure that Canada is very well set to be able to proceed in the upcoming future. So I also want to acknowledge the arrival of one of my other colleagues, MP James Maloney. And I believe we'll be inviting him very shortly to also provide the remarks. But in the meantime, PS Rob Oliphant, floor is yours, sir. Thank you.
Thank you, Mathieu. Merci pour la société ici, pour l'hospitalité, d'avoir l'opportunité de partager les nouvelles. C'est très bon aujourd'hui. They give me remarks. I'm going to avoid them for a moment. When I began the political journey in 2008, one of the strongest concerns in the area I live in Thorncliffe Park, was foreign credential recognition. People who had come to Canada with their dreams, with their ideas, with their skills, with their experience, feeling frustrated that they weren't able to contribute the way they wanted to. We have made steady progress, particularly in the last 10 years since being government, at opening doors, at working with provinces and territories, at working with regulatory bodies and associations to open those doors, but we're not finished yet. When I began, the problem was largely about individuals who needed to have their credentials recognized. It's now different in the healthcare world. We need them more to have their credentials recognized. There's been a shift in the need. That's partly our aging population. That's partly the retirements of those who have decided to leave those professions. And we now have two problems we need to address. Not only the resources of those with the experience, the credentials needing to be recognized, and the skill sets that Canadians have, but Canadians who need healthcare professionals. We need doctors and nurses and physiotherapists and occupational therapists. We need healthcare workers. We need caregivers. We need technicians and technologists. To do that, the government will continue to invest in the organizations which will help do them. And I have 3 words in my head about that today in this announcement. Thank you, Minister. One is support. The journey is long for newcomers in this country, and it's difficult, and they need constant socioeconomic support to make a difference in the world. They also need mentorship, and they need someone or groups who will guide them and walk with them through the journey that they need to take to get their credentials recognized and to get employment in their professions. The third thing they need is a navigator. They need someone who knows the system, who walks every day, and who technically advises them how to do what they need to do. So whether it's success, particularly in Vancouver, but also in Ontario, whether it's la société ici pour les francophones en Ontario, au nord ou à l'ouest ou à l'est Ontario, whether it is in Atlantic Canada with the African Healthcare Group that will be working with that, or any of the organizations that are supported by this $14 million announcement today, we will continue to support, to mentor, to educate, and to navigate with people making a difference in the world. I'm getting older. I have a vested interest in healthcare that I never had before. We are all aging by the day. And in that way, I want to have a skilled labor force, a skilled workforce, particularly healthcare professionals who will walk with me every day until I'm done. And I know that we have resources below the ground in this country. That is why Canada is a great place to live, but we have even better resources above the ground, walking, ready to work, ready to engage. Thank you, Minister. And on behalf of the people of Toronto, particularly the Greater Toronto Area, and my own riding of Don Valley West, where we have newcomers wanting to serve, wanting to contribute, thank you. Thank you to the associations, to the organizations that are doing this work.
Thank you, PS Rob Oliphant. And really, the word of bridging and enabling and empowering and expediting is really can bring the essence of what this program is all about. So I would like to, at this time, like to ask PS James Maloney also join us for brief remarks.
Thanks, Steve. Rob, you're quite right. We all are aging, so I won't take up time, and so you don't age too much while I'm speaking. Look, the reason I'm here, I'm a member of Parliament from Toronto, but I'm part of a profession myself. I was a lawyer before I went into politics. And something we've experienced as a province and as a country is regulated professions who have been restrictive in admission of people with foreign credentials. My predecessor as a member of Parliament at Etobicoke Lakeshore was a woman by the Honourable Jean Augustine. After she left federal politics, she was appointed as the first fairness commissioner in this province to try to address that problem specifically. She met with some success, but we still have a lot of challenges. And that's why what we're doing today with Minister MacKinnon is so incredible. And that's why I made the effort to come down here today, because I can take you to facilities in my riding, and Rob's right. It's physiotherapists, it's chiropractors, you name it. Anybody in the health profession, they are short of people. And we need them, Rob, you're right, more than they need us right now. Because we've all heard the story about the cab driver who's a doctor from another country. There are an endless amount of stories like that, and this is the program that's going to bring that to a conclusion. So, or help bring it to a conclusion, working with the provinces, but with organizations like the one we're here today. So I just want to say thank you very much. And I will end with this. Foreign credential recognition doesn't just apply to newcomers. It applies to Canadians who are studying abroad as well, because there are a number of Canadians who go to medical school or become physiotherapists in foreign countries, and they come back here and they meet with the identical set of challenges. And that's an area that has to be addressed too in conjunction with the province, and this program is going to help that as well. So Minister, thank you very much, and I appreciate the opportunity to be here and join you.
Thank you, P.S. Maloney. And finally, I'd like to invite and introduce Mr. Fauzi Mitoli as part of the board members of this organization to come in and provide some remarks. Thank you.
Donc, my speech will be in French.
Voilà.
Yeah. Donc, on va donner un petit peu le... Monsieur le ministre, honorable MacKinnon, Steve MacKinnon, mesdames et messieurs les députés, chers partenaires invités, je suis honoré de prendre la parole aujourd'hui au nom de la Société économique de l'Ontario, à l'occasion de cette annonce d'investissement majeur dans le secteur de la santé. Nous remercions le gouvernement fédéral et Emploi et Développement social Canada pour leur confiance et leur reconnaissance dans notre engagement envers l'intégration des travailleurs qualifiés francophones et bilingues de l'Ontario. L'investissement annoncé aujourd'hui dans le cadre du programme de reconnaissance de titres des compétences étrangères répond aux défis du marché du travail, notamment dans le secteur des soins de la santé. Alors que la demande en personnel qualifié augmente, de nombreux professionnels formés à l'étranger peinent à faire reconnaître leurs compétences. En levant ces obstacles, nous favorisons l'inclusion et renforçons l'efficacité de notre système de santé. La Société économique de l'Ontario est fière d'être bénéficiaire de ce programme et de mettre en œuvre Carriel Santé en Ontario et en Colombie-Britannique. Cette initiative accompagnera les femmes nouvelles arrivantes du secteur de la santé formées à l'étranger en facilitant la reconnaissance de leurs titres de compétences et leur insertion sur le marché du travail. En soutenant ces professionnels hautement qualifiés, nous contribuons à répondre aux besoins urgents du secteur tout en favorisant diversité et inclusion. En tant que leader du développement économique francophone en Ontario, la Société économique de l'Ontario collabore avec les employeurs, institutions, organismes communautaires, instances gouvernementales pour bâtir des solutions innovantes et durables. Notre mandat est clair: favoriser l'épanouissement économique des francophones et bilingues tout en contribuant à la compétitivité de la province. Ce soutien du gouvernement fédéral confirme le rôle essentiel de la Société économique de l'Ontario et de ses partenaires dans l'essor économique de l'Ontario français. Nous remercions le gouvernement fédéral, le ministre MacKinnon, EDSC, la RD, Canada et nos partenaires pour leur engagement. Enfin, rien de cela ne serait possible dans l'engagement exceptionnel des employés et professionnels de la Société économique de l'Ontario, qui travaillent chaque jour avec passion et expertise pour dynamiser notre communauté. Ensemble, nous bâtissons un Ontario plus fort, inclusif et prospère. Je vous remercie. Je vous remercie.
Thank you, Mr. Mitoli. And at this point, we're going to go to the media availability, which is going to be moderated by John from the Mr. McKinnon's office. So, John.
Come on in, guys. Jamie?
Hello, Minister.
Good morning.
Ali Elwell from CBC News.
Hi, Ali.
Si vous pouvez répondre en français aussi, s'il vous plaît. We're expecting pretty significant layoffs in the next coming weeks with the tariffs now in place. You've talked about Canada's strong social net to help workers through job losses. But what moves are you making? What is in place for workers in the next few weeks?
Well, there will be a robust response, but first things first, you will see the government in a matter of minutes. The Prime Minister, a number of our colleagues will be announcing formally announcing Canada's response to these ill-considered, unjustified tariffs. We did not seek this trade dispute, but we are in it now, and Canadians will be asked to rally, and I know they will, to a very robust response. That response will inflict considerable economic damage on the United States. We export, for example, the large majority of their aluminum and their potash. These are key commodities in their industrial base, whether it be a can of Bud Light or an airplane from Boeing that's made with Canadian aluminum. If it's a crop grown in the United States, it's made, fertilized by Canadian potash. Those things just got a lot more expensive, and that puts jobs at risk and raises prices significantly for Americans. We will be making this point continuously, and I know there are a number of Americans who will be making this point. But let's not pretend the tariffs will not have a major impact in this country as well. They will. And nothing will replace a job. So Canada, with its strong, robust safety net, will be there. We will protect as best we can our workers, particularly those long-tenured workers in industries that are exposed to trade measures. We'll be outlining in the coming days specifically what they are, but you can assume that we will be expanding that safety net to catch as many workers and put a net under them, knowing again that nothing replaces a job, and we'll be fighting for those Canadian jobs day by day, week by week. This country will have, I know, a number of responses, but the Government of Canada will be responding very forcefully and demonstrating what I think are our values. We look after our own. Donc en français, nous n'avons pas cherché cette guerre commerciale, nous n'avons pas cherché des tarifs, nous croyons que nous sommes meilleurs ensemble avec les États-Unis et nous avons créé une zone de prospérité inégalée dans l'histoire du monde. Mais représailles, il y aura. Personne ne gagne dans une guerre commerciale. Nous n'aimons pas les tarifs, mais le Canada se doit de répondre de façon robuste. Vous allez voir le Premier ministre et bon nombre de nos collègues annoncer sous peu la réponse formelle du gouvernement. Ça va faire mal. Ça va infliger des dégâts économiques aux États-Unis. Si on ne pense qu'à l'aluminium et la potasse, parmi tant d'autres, qui sont des intrants extraordinairement importants dans des industries névralgiques aux États-Unis, dans l'agriculture américaine, ça va augmenter les prix et mettre des jobs en péril aux États-Unis. Il y aura évidemment aussi un impact au Canada. Nous ne pouvons pas prétendre du contraire. Donc c'est pour ça que le gouvernement aura une réponse robuste aussi en utilisant et en développant notre filet social, surtout le mieux qu'on peut pour protéger des travailleurs exposés au commerce qui sont des travailleurs de longue date dans leurs industries respectives. Les Canadiens peuvent être rassurés que le Canada sera là pour eux. Personne n'ose prétendre qu'on peut remplacer un emploi, mais nous avons un système qui protège et qui fournit un filet en dessous des travailleurs pour pas qu'ils tombent trop loin. Ce sur quoi les Américains ne peuvent pas compter.
Can you share a little bit more about how you'll be utilizing either the EI system or CERB, things from steel and aluminum tariffs 1.0? Like,
Yep.
what system are you going to be using?
Well, we will be relying heavily on the EI system. The specifics of that I'm not going to get into today, but we will be getting and announcing those before long. The fact is that as bad as this will be, it is not the pandemic, and I think it's important that we underscore that fact. The pandemic, we essentially switched off the economy more or less overnight. This will have significant impacts, but they'll be more slow rolling. And so we will have measures that are the equal of the situation that we face. And so that's why the measures that we've designed and the package that we've come up with will be tailor-made to the situation in which we find ourselves and not rely on prior experience.
With respect, though, Minister, Canadians, it might not be like COVID, but that fear is still very real. So, and you've had now months of this. How come we're having to wait days to get this information?
Well, I think you will see outlined over a very, very short period of time the product of a number of months of preparation. Our first obligation was to try and avoid this scenario. We, I think, demonstrated conclusively to our American friends that fentanyl, illegal or immigration across our border was, to the extent that it is a problem best solved together. We all benefit from a secure border. And Canada was very much engaged in the work of trying to persuade our American friends that this was not the right idea, not a good idea, and would harm both of our economies. That was our first duty. Now that it appears that the President has decided otherwise, you can expect that a lot of other work that was done to prepare for this very eventuality will be announced in a very short period of time.
Et en français, s'il vous plaît?
Vous pouvez vous attendre à ce que nos mesures, notre préparation, notre plan pour répondre sera divulgué dans un très court laps de temps. Nous avions comme premier devoir d'essayer d'empêcher l'imposition de tarifs et nous avons prouvé, je pense, de façon concluante pour nos amis américains que ces tarifs, sur la base de ce qui se passe à la frontière, le fentanyl et l'immigration et j'en passe, ce n'était pas une considération. Et dans la mesure où ça peut être une considération, ce sont des enjeux qui sont mieux attaqués ensemble. Ceci n'ayant pas fini en accord avec le président des États-Unis, vous pouvez vous attendre à ce que nous allons rapidement divulguer notre réponse très robuste, protection des travailleurs, riposte aux tarifs et d'autres mesures dans un très court laps de temps. Thank you, everyone. Merci à la société de nous accueillir ce matin. Effectivement, nous sommes dans des temps incertains, mais soyez rassurés que nous allons maintenir notre plan et nous vous remercions. Nous allons nous fier et nous voulons poursuivre la collaboration avec des gens comme vous, justement, afin de bâtir un Canada meilleur. Merci à vous. By all means.
Just move this out.